Stakeholders seek universal health coverage strategies for 2030 success in Borno. The federal government has appealed to the Medical and Dental Consultants Association to call off its 7 days warning strike. It made the call during the 65th National Council on Health workshop held in Maiduguri with the theme Accelerating Pathways to Universal Health Coverage Strategies for 2030 Success. The workshop aims to draft actionable policies that will address challenges of Nigeria's health sector, ensure that Nigerians, regardless of financial constraints and hardship, access healthcare services they deserve. The Federal Ministry of Health called on the striking doctors to return to work and support President Tinubu's agenda for a better healthcare coverage across the country. Meanwhile, Governor Zulum in his speech approved pay raise for medical doctors in the state to bridge the disparities with their colleagues working with the federal government. He revealed that the state has complied with Abuja's declaration, which requires states to allocate 15% budget to health.
The goal to save lives, reduce both physical and financial pain, and produce health for all Nigerians. At this juncture, I also want to direct the Commissioner for Health in Borno State and indeed the head of service to link up with the Minister of Budget and ensure that there is no disparity between salaries of the federal health workers and that of the state.
The Renew Hope agenda of President Bola Ahmed Tinubu, GCFR, for the health sector is to provide to all Nigerians, particularly the vulnerable population, qualitative, accessible, affordable, and responsive healthcare services that does not put the Nigerian in financial hardship. Universal healthcare coverage by 2030 for us is therefore not just a slogan or a catchphrase, but a commitment that is backed by a robust pathway to deliver on needs in an inclusive, equitable, and evidence-driven manner. The challenge of recurrent strike in the health sector is clearly a major factor that can derail our set-out plans for the renewal of the health sector in our country. The incessant strike in the health sector is not only demarketing the sector and the various professional bodies within the system, it is a major stumbling block to the universal health coverage agenda. This is therefore one area that we are prioritizing by putting in place a robust mechanism to ensure that strikes within the health sector are prevented as much as possible. I must at this point, therefore, appeal to the Medical and Dental Consultants Association, who are currently on a 7-day warning strike, to please call off the strike. The core of the issues that necessitated the strike action are actually not within the mandate of the Federal Ministry of Health and Social Welfare, and I am aware that a number of them is already being addressed.
And you've also set out really articulate plans about how you will deliver that mission. So a lot has happened, and we also recognise that this is not starting from scratch for states in particular. This is building on the successes, the challenges, and the experiences that you've had over many years. But it's also an opportunity for us as health development partners to take a step back and reflect. And we can reflect on the areas where we've really lent in and supported heavily, but also where some of the challenges are ahead.
Nayanandan, Kama TV.